Hello, and welcome to ADCES's podcast, The Huddle, Conversations with the Diabetes Care Team. In each episode, we speak with guests from across the diabetes care space to bring you perspectives, issues, and updates that elevate your role, inform your practice, and ignite your passion. I'm Patty Scalzo, Director of Diabetes Technology Initiatives at ADCES, and today we're having a discussion with Molly Wagman, RDN CDCES, the U.S. Head of Clinical Operations at MySugr, who's a winner of the 2020 ADCES Innovative Use of Technology Award. You can learn more about the other award winners and how to apply at diabeteseducator.org/awards. Welcome to the Huddle, Molly. Please share with the listeners some of your background and what it was like to enter and win this award.
Hi, yes, thank you so much for having me. Yes, I'm a registered dietitian nutritionist, and I've been a certified diabetes care and education specialist for about 5 years now. And I started out my career actually in food service as a dietitian, but very quickly realized I wanted to work in clinical and specifically diabetes. So my first clinical job, I got to work in a long-term care facility and lead some diabetes care initiatives there, which was a really cool opportunity for someone just starting out. And then I had a very cool opportunity to work in a endocrinology clinic, a private practice, and be the certified educator there. And I knew that technology was also a passion of mine. So I worked for a continuous glucose monitoring company and then made my way here to MySugr as the head of clinical operations for the US team.
Oh, that's great, Molly. And so what made you decide to apply for the Innovative Use of Technology Award?
So I always attend the conferences, and I am very up all of the extracurricular things that are happening around it. But I had a friend who told me about the awards and asked me to apply because she's also a CDCES and knew that we were doing some interesting things here at MySugr. I get to work with a diverse team that I know a lot of other diabetes care and education specialists don't have. And I thought that others might find what we're doing pretty interesting.
For our listeners out there, Molly created a fully remote education program called The Challenges, and it provides education, support, and engagement opportunities for people with diabetes. Molly, could you please share with us some more about your award-winning program?
Yeah, so first I want to talk a little bit about MySugr itself so we know what we're starting with. So MySugr is an all-inclusive daily diabetes logbook app. So it allows you to log everything related to your diabetes, like blood glucose, of course, and food, exercise. And we have a bundle subscription. And this subscription, you get a personal diabetes coach, and we're all certified diabetes care and education specialists. And with that, you also get unlimited blood glucose test strips. And we also provide completely individualized support in diabetes education. So goal setting, data review. And these challenges are more of a structured short-term education. So with the coaching component, you always have access to your coach through the app. You can just send us a message, just like a text message through the MySugr app. But we wanted to offer something a little bit more structured and specific. So these challenges, the ones that we won this award for, were for our winter challenge, which is a 4-week challenge focused on setting up yourself for success during the winter months. Because diabetes management can often suffer during this time because we get distracted by holidays and family, friends, and even the winter months itself can make us feel blue. So we wanted to give this an opportunity to set yourself up for success. And for our heart health challenge, this was around learning more about how diabetes and heart health go together. And this was a 2-week challenge where we focused on learning your numbers and starting to log things around heart health.
Wow, that sounds great, Molly. And how did you go about identifying the challenges that you chose?
We really just looked at where we saw a need. So as coaches, we are interacting with our users, our patients, the people with diabetes, and they kind of tell us what they want. And we can tell that there is a need for certain types of, figuring out how to figure out certain parts of your diabetes management. And oftentimes mental health and just learning the basics are so important and often requested to dive deeper into these subjects.
Yeah, I know last time we spoke too, you had shared with me that sometimes this is the sole source of diabetes education that these folks get.
Yes, oftentimes it is because most of our users with diabetes are type 2, and they're often not on insulin and take oral medications or have no medications. So they don't usually see an endocrinologist, and they often have never seen a certified diabetes care and education specialist. They're seeing just their primary care doctor, and they're definitely not getting that more comprehensive education support and just the basic knowledge of what they need to do to manage their diabetes every day.
Yeah, so we see the role of digital tools as really important in this particular population. What role do you see with the technology and the digital tools in the future for diabetes management?
I think it's going to be so important. Ongoing education of diabetes, I think it's important. So, diabetes is this 24/7, no breaks deal. And the person with diabetes is making their own therapy decisions every single day without the help of a medical professional. So, if you can have someone like a diabetes coach just right at your fingertips, you have that quick responsiveness. So, for example, like with my sugar and the coaching, we are going to get back to you pretty quickly so you can learn in the moment. So, if you have questions or you want feedback about any logs that you've made, then you can get that right away. And it's almost like learn by doing rather than waiting 3 or 6 or 12 months until you have a phone call or make an appointment with your physician.
How do you close the loop with the communication back to the healthcare provider then?
Yes, so we really work on empowering the user with diabetes to communicate with their physician. So we at My Sugar Coaching, we do offer a summary. If they've been working with us pretty closely, we'll offer to send a summary to their physician of what we've been working on and any goals that they've achieved. But we really empower the user to go back to their physician and give them their report with all of their different logs. Because with the PDF report in My Sugar, you have all of the data in one place. But it's really up to the person with diabetes to advocate their own health and to ask the questions that they need. So we can also help guide them there and help them decide what's really important for them to learn about their diabetes management, maybe what gaps there are, and help them really prepare to have a conversation with their doctor that only lasts 15 minutes probably.
Yeah, that's a good point. And how do you think the primary care provider views the coach as part of the healthcare team?
I think that it can go one of two ways. So we luckily have had pretty positive responses from the medical community. So I think that physicians can see us as an adjunct and something really helpful. But I think it's also something where we need to be careful. We want to make sure we're not stepping on the physician's toes. We don't want to act like we're taking over their patient.
Yeah, that makes sense. And so do you think that digital health tools and apps and virtual coaching, do you think all of that is a really important part of the future of diabetes care?
I think it really is because it does offer that more quick responsiveness, which I think is important for diabetes management. Because again, you're making these new, many decisions every day. It also allows you to set up new methods of engagement and interaction with your educator or your medical team. Like the challenges, for example, where you could have structured short term education in small bites, or keep all of your diabetes data, including medications and everything, in one place, because there's a lot that you have to juggle with diabetes management. And then just the logistics, I think, of digital tools, like the ease of appointments. So if you're able to have a virtual appointment with your diabetes educator or with your physician, then that can really ease the burden of the travel or any time, et cetera, especially for people who may live in more remote areas.
Hmm. And walking back a little bit to what you were saying about data, so do you feel like the people with diabetes use their data themselves, or do you think it's more used by the healthcare team to make change?
I think it's used by both. I think definitely the people that we see within My Sugar are already pretty motivated to log data and have that. So I think that from my perspective, I also see it from the user perspective that they are really wanting to use this data as well. And that's where we come in as educators, is to help make sense of the data and help the people with diabetes learn what their data means, how to interpret it, how to stay curious, how to really know when is the right time to test blood glucose, how different foods affect your blood glucose, how sleep affects your blood glucose. So there's so many different things that affect diabetes management. And being able to have these different data points is a great education tool. And then from the provider perspective, when you have all of this data and it's all in one place, again, I think that's really important, because I remember when I worked in the clinic and I would have sometimes 4 different sheets that I'm looking at, like a blood glucose printout, a food log, maybe some pictures, that the phone of the person with diabetes. So if it's all in one place, it gives context to the data points as well. And I think that that's makes it much easier to make any kind of clinical conclusions and make any changes in therapy.
Yeah, it sure does. Now, let's take a break to hear more about an exclusive member benefit from ADCES. Turn to danatech.org for all your diabetes tech-related needs. danatech.org is an ADCES member-only website offering continuing education on topics like CGMs, connected insulin devices, and do-it-yourself solutions. danatech.org also lets you explore and compare the wide range of technology products and apps on the market. If you're an ADCES member, go to danatech.org and check it out. If you're not a member yet, join today at diabeteseducator.org/join. I remember last time we were talking, Molly, and you were explaining to me kind of how you use those challenges to explain the why, like why somebody should have to do things or why it's best to do them.
Exactly. Yes. So something that my good friend and colleague Scott Johnson said is, let's help people find their why. And because I really think that that was really powerful. And I think that people with diabetes, again, because it's so complex, you need to find a reason to manage your diabetes and to stay motivated, because it can be extremely overwhelming. And I myself live with type 1 diabetes, and I'm a practitioner and I work in diabetes, and I still find diabetes management a little bit overwhelming sometimes. So when someone doesn't have even the basics down or a reason why that they should care about their diabetes management, I think it makes it tougher. So when we help support them in that way too, is like, well, why do you care about your health? Why is this important to you to learn about heart health and your diabetes management? And oftentimes there's an emotional tie. It's like, I want to be able to be there for my grandkids. I want to be able to cook and clean my house and just take care of the daily living activities. Is oftentimes it's not just, well, because my doctor said so.
That sounds like motivational interviewing in practice.
Yes, it is.
That's good to hear. So, in addition to apps, what do you think are some other ways that ADCES accredited diabetes self-management education programs can be leveraged in various settings?
Well, I think first that it needs to be said that diabetes care and education specialists are not utilized as often as we should be. So, of course, we should be consulted for people with diabetes, which is a lot of people in the hospitals and in clinics, because we bring this support and guidance to the diabetes specialty. But I think we're really, really key and important to filling in the gap that the DP doesn't provide. And it's no fault to them, really. They are so short on time and they have to know so much about so much. And the nitty gritty details about diabetes management often just gets shuttled to the side. So if we can help there and fill in the gap in the PCP world, I think that's where we can really play a good role.
Yeah, definitely. So are your coaches all CDCESs?
Yes. And that's very important to us at My Sugar because we want to make sure that we have true diabetes specialists. And we don't want just someone who is a health coach or doesn't have the diabetes background, because again, diabetes is so complex, and there's even complexity within the types of diabetes. Like we have some diabetes educators who are specialists within type 1 diabetes or type 2, or are really great. We have a variety of CDCESs. We have nurses, dietitians, and exercise physiologists, and we're missing psychologists. That would be really helpful to add to our team. But there's so many different things that need to be touched on that even the diabetes care and education specialists can't be an expert in all areas of diabetes.
Yes, and I think it's really great that we can offer education in so many different formats now.
I think so too. And I think that the digital part is so important because most people have a phone and they always have it on them. And so if we're able to give them little bites of education and support throughout their day, throughout their weeks, I think that's important. And I think another way too, if I can go back to another way that diabetes self-management education can be leveraged, is to provide a community aspect. Oftentimes I feel like even though there's so many people that live with diabetes, often people with diabetes don't know anyone else with diabetes because we're not really talking about it. There's a little bit, I think, of shame sometimes around it. And I think that the community part is important. So, of course, in person gatherings, maybe not calling them support groups anymore. I think not a lot of people want to go to a support group, but if you call it like a hangout, something like that. But even on the digital platforms, now we're getting so good with Zoom, all of us. So a live, maybe Zoom call where you can get together and people with diabetes can meet each other and talk about their daily lives, I think is a really cool thing.
Yeah, those social networks and support are so important. What about the diabetes care and education specialists? How do you see them learning ways to better integrate technology into their practice and find that support they need for learning about technology?
Yes, this is also a very important topic and can be overwhelming because it seems like there's a lot of different apps, a lot of different digital tools out there now. So I would say go straight to your trusted sources like the ADA and ADCES with Dana Tech. I think that Dana is a really great tool because it stays up to date with all of the new technology. And ADA also has a technology interest group. So if you're a part of the American Diabetes Association, you can join interest groups. And that helps you know that you're getting the most updated information that's reviewed by the professionals and the trusted sources. I also think that if you're looking into a new tool and you find it interesting, try it yourself. Try these different apps for a couple weeks and see if you like them. Because if you don't like it, your patient is definitely not going to like it. So if you find a couple tools that you really like and you can bring your enthusiasm to it, if you really think it's going to help your patients, then they're going to want to use it much more as well.
I am a firm believer of trying those apps out yourself. I think that really is so helpful to learn all about them.
Yeah, I think so too. I think that there's so much out there that if you can just try with a few, maybe the top rated ones from your professional sites, that can get you started and oftentimes make you go, oh, this app is missing this. I wonder if there's an app out there that does this instead. I also think that utilizing the conferences like ADCES and ADA, now that they're virtual, or maybe it'll continue in the future, it's easier. But there's usually at the booths, the exhibition fairs, there's always the newest technology out there, and you can learn a lot at these conferences.
Definitely. Well, we've covered a lot today, Molly, and I've really enjoyed you being our guest today. Do you have any other things you'd like to share with us?
Yes, of course I'm biased, but I think we're such an integral part of the care team. So definitely don't hesitate to speak up or get creative with your diabetes self-management education and support. I think that using your creativity benefits you as the educator to help you from burnout and to stay excited about what you do. And then it also benefits the patients. And also be open to learning from your patients because, again, this is 24/7, and the person with diabetes knows their diabetes the best, even if they don't know all of the medical knowledge, even if they don't know all the ins and outs of how to best manage their diabetes to get to certain clinical goals. They're the ones that are living with it every day. So we're really good at that as diabetes educators, is to listen and provide individualized support. So keep doing that.
Thank you for articulating that so well, Molly. It's been such a pleasure to have you with us today. Thank you so much.
Thank you.
Thank you for listening to this week's episode of The Huddle, Conversations with the Diabetes Care Team. Today we heard from Molly Wagman, RDN, CD, CES, about her award-winning program, The Challenges, and some helpful tips and resources for the DCES to better integrate technology into their practice. Please be sure to check out the show notes for additional resources. Membership at ADCES gives you access to the education, networking, and resources to improve your practice and optimize outcomes for your clients. Find out what ADCES can do for you at diabeteseducator.org/join. The information in this podcast is for informational purposes only and may not be appropriate or applicable for your individual circumstances. This podcast does not provide medical or professional advice and is not a substitute for consultation with a healthcare professional. Please consult your healthcare professional for any medical questions.